Colposcopy is a diagnostic procedure where your physician uses a microscope and we magnify and look at the cells on the cervix and identify the abnormal cells. The procedure itself usually takes 5 to 10 minutes. We do that in the office under no anesthesia. However, you can take ibuprofen or Tylenol if you'd like to help with cramps. Colposcopy is also used to identify if you have genital warts, cervical polyps. It can help to diagnose pain or bleeding, or if you have an infection of the cervix. The colposcopy is done similar to a pap smear, except the physician's going to put a vinegar solution on your cervix. This vinegar solution, it will actually change the abnormal cells on your cervix to a white color, so we can identify the cells that are abnormal. Once we identify those cells, a biopsy is taken. We also do a blind biopsy on the glandular cells that can go deep into the cervix, because remember, we cannot see into the cervix. We can only see on the outside. So this tissue is then sent to the pathologist. The pathologist will look at it and let us know what type or classification of abnormal cells they are. So most people do a little bit of bleeding after a colposcopy, and we put in this mustard thick solution, this medicine that will help coagulate or stop the bleeding. And this actually causes a pretty thick, heavy discharge that's dark in color that may remain for about a week. So we tell patients there's no sex, no tampons, no douching, nothing in the vagina for about a week until that goes away. The colposcopy has minimal problems or side effects, but please call your physician if at any point you have a fever or chills, heavy vaginal bleeding, or you think you have an abnormal discharge. An endometrial biopsy is recommended only if the PAP test shows atypical glandular cells of the cervix. We cannot tell if the glandular cells are from the outside of the cervix, the inner cervix, or even the endometrium, so an endometrial biopsy is recommended at that point. There are two ways to remove abnormal cells on the cervix. Those are excisional procedures and ablative procedures. The excisional procedures will remove part of the cervix so tissue is able to be sent to a pathologist. The ablative procedures are where tissue is destroyed, so no tissue is able to be sent to the pathologist. The two types of excisional procedures, the first one is the LEEP procedure. That's loop electric excision procedure. That's where the physician, either in the outpatient surgery center or in the office under sedation, uses an instrument that has an electric wire at the end of an instrument, and we remove a shallow part of the outside of the cervix. The conization, which is the second type of excisional procedure, this is done when we're worried that a deeper part of the cervix is involved, and therefore a deeper cut or cone-shaped biopsy is taken of the cervix. This is done only in the OR under sedation, and this tissue is also sent to the pathologist. The ablative techniques that we use, cryotherapy is one that we do in the office and requires minimal sedation, maybe just ibuprofen and Tylenol. This instrument will freeze the cells on the cervix, and then as those cells thaw, they slough off and the abnormal cells are removed. The last type of ablative procedure is a laser. We do this only in the OR under sedation, and it's where a focused beam of light actually destroys the cells on the cervix that are abnormal. The goal of all PAP testing is really to identify those women that are at increased risk for cervical cancer. If we can diagnose and treat abnormal cells on the cervix, then cervical cancer can be prevented.